We'll go a little out of order because we have some things in rules. We'll introduce House Bill 590, Representative White. Without objection, the PCS is properly before the committee. Not hearing any objections, the PCS is before the committee. Representative White, I just found out earlier she's Snow White's older sister. Younger. Y'all don't, you need these glasses if you
Thank you, Mr. Chairman. Welcome to everyone that's here with us tonight. Obviously, we have got so many makeups committees. I'm not sure that we have as many as we need to have in here, but we're glad you all are here. And thank you for our guests that are back there that are coming to support this bill. This bill is forming a new organization that is, it's an article that is actually going to form a new way for folks to be licensed that need to be licensed, and people to have a body of work and someone they can go to. And I'm going to say that it's very similar to like the Board of Nursing. So this is it's an act providing for enhancing patient safety in medical imaging by ensuring educationally prepared and clinically competent persons perform and administer medical imaging and radiation therapy procedures. And what that has done is this article is been cited as the Patient Safety in Medical Imaging Act. The General Assembly finds and declares that citizens in this state are entitled to the highest quality of care and maximum protection predictable from the harmful effect of improperly performed medical imaging and radiation therapy procedures, and that protection and quality can be increased by requiring appropriate education and licensure of persons operating equipment used for medical imaging and radiation therapy procedures. Therefore, it is essential to establish standards of education for these professionals and to provide appropriate examination and licensure. I just want to ask you to think back in your history of healthcare and anyone that you know. Have you ever had someone come up to you and tell you that they had a X-ray, some type of radiation test, and they found out that, and they were told they were clear and everything was fine, and then in just a little while it was not? That is what we are trying to take care of with this article and this new board that is being established by this bill. What we want people to know in North Carolina is that when they go to a physician's office or a hospital or a clinic or wherever they go, and there is somebody there that's going to do a test on them that requires an X-ray, or a derivative of that they are going to get that, and it's going to be done, and the person who is doing it for them knows what they're doing. And that's what our research and our complaints and our list of people that have been damaged. Some people have died because of misdiagnosis because they didn't have a proper test, a person to do the test that knew what they were doing. And so that in a nutshell is what this bill is about. It's consistent. It's going to provide consistency. The bill will create consistent education, certification, continuing education, and competency via licensure and scope of practice for individuals performing diagnostic medical sonography, limited X-ray, magnetic resonance imaging, nuclear medicine technology, radiation therapy, radiography, and so on and so on and so on. There'll be qualified practitioners. The Enhancing Patient Safety in Medical Imaging and Radiation Therapy Act helps ensure that only educationally prepared and clinically competent individuals are licensed and recognized as qualified practitioners to administer ionizing radiation and or other highly technical procedures. These qualified practitioners increase patient safety and improve access to high-quality healthcare services. This includes grandfathering provisions to ensure professionals currently working can continue serving patients' needs. So we're not trying to take this away from someone who's already practicing, but we're trying to make sure from this point going forward that if you provide these services, that you are properly trained and have a license to do that. Transparency. North Carolina residents are left to assume their healthcare providers are well educated, trained, and competent. However, the state does not currently require standards or a licensure to help ensure patient safety. This bill will ensure that the individuals performing these procedures are educated in radiation protection, safety procedures, and medical imaging and radiation therapy patient care. This states the conditions which require a license to operate medical imaging and radiation therapy equipment. This will enlarge their scope of practice, states the conditions that are acceptable exemptions, further defines the scope of practice limitations in 10 imaging modalities, creates the Medical Imaging and Radiation Therapy Board of Examiners, provides for the board's competition, establishes the power of the board under this chapter and the state administrative procedures, specifically lists the requirements for licensure under each modality, includes limited X-ray machine operator. This includes a 2-year grandfathering provision for those currently working in the profession, and requires regular record keeping, requires the applicant licensee to provide evidence of examinations of all modalities, specifically recognizes additional exams and certifications for limited X-ray operators, chiropractic and pediatric certifications, provides for the licensing of qualified individuals, including temporary license, and requires a copy of license to be available at the place of employment. Empowers the board to improve educational programs and consultation and national organizations. And I won't go, it's a lot more that it's going to do, but the one area that is also included in here that we did not include, but we did, that's why we did the PCS. We had the nurses in, but for some reason it just wasn't captured in the original bill. So nurse practitioners, nurse anesthetists, and registered nurses who are qualified and trained to do this will be an exemption. They will not have to go any further with this. So that is basically what it's going to do. And if you value your health, if you anticipate, we have folks in our room today that are having some health issues, and we are very thankful that they are in a place where there's a lot of healthcare folks that want the very best for them. But we also know that we've got to make sure that it's out there for those people who don't know and don't have someone that is looking out for them. We are not targeting any particular entity or any particular type of facility that may or may not be using trained professionals. We're just saying from this point forward, when you get an X-ray, when you get one of these modalities, that you are going to be getting it by someone who is trained and keeping up with their stats, and every 2 years they have to be re-licensed. I'm sorry, every year they have to be re-licensed. And so we just think this is the best way to go. We've had no opposition to this. We've had such great support across the state. Are you going to make the motion? Thank you.
We have 3 motions.
Okay, go for it.
Mr. Chair.
Yes.
I'll be glad to when she quits talking.
I'm quitted talking.
Is there anybody who would dare say anything? If you do, you could be ejected. Hearing none, Chair will entertain a motion. Dr. Reader.
Yes, I recommend a favorable motion to the PCS, unfavorable to the original rule in the PCS, to go to Finance Committee next.
Thank you. You've heard the motion. All in favor, aye. Aye. Any opposed? Thank you. The motion passes.
Thank you, Dr. Reader. I appreciate that.
Thank you.
And I need to thank Representative Potts for being a primary, and also Representative Gillespie. Thank you all so very, very much. And I want to also give a shout out to my peeps down from Johnson County at the JCC program, and they've been very helpful in all of this. Thank you very much.
Thank you, Chairman White. Representative Gillespie, you're recognized.
Thank you, Mr. Chairman. Good afternoon, or good evening, committee members. We want to do that.
You have an amendment on. Would you like to send the amendment forward? We have the amendment.
You have the amendment.
announce the bill.
Oh, I'm sorry, we're doing, we moved around because we're doing 433 because our member has to go to rules after this. We have an amendment. Are you,
Willis and Cunningham also have to go to rules.
all right, we'll get them next. There's amendment, the amendment has been sent forth and is on the, is there a motion to adopt the amendment? Thank you, Representative Shepherd. All in favor, aye. Any opposed likewise? Hearing none, you're recognized to present your bill as amended.
Thank you, Mr. Chairman. House Bill 433 simply does one thing, and that's to try to address the shortages of school nurses. We do this bill would do this through making it so that a licensed registered nurse in the state of North Carolina that has 2 years experience in hospital or health clinic setting can become a school nurse and qualify for higher certified school nurse scale pay due to their 2 years on the job experience. I'd ask for your support.
Thank you. Any questions for Representative Gillespie? Hearing none, I'll entertain a motion favorable to the House Bill 433 as amended, unfavorable to the original bill, rolled in a new PS and referral to rules.
That was going to be my motion. You took it away from me, sir.
Thank you. Well, you sent it in earlier. I appreciate that.
Actually, I threw my voice to the chair.
All in favor, aye.
Aye.
Any opposed? The motion's passed. The bill's passed. We recognize Representative Willis for his bill.
Thank you, Mr. Chairman.
House Bill 572.
Thank you, Mr. Chair, and thank you, committee, for hearing this. This is a veterans pilot program, and I'll say it one time because I can only get it out once. The electroencephalogram combined transcranial magnetic stimulation treatment, and I'll just call it TMS from here on, is really designed to help those that are suffering from PTSD, from traumatic brain injuries, substance abuse, other things in our veteran community, those that have been on the front lines and have served. We're also looking to help those within our law enforcement, our first responders, our firefighters who have dealt with significant injuries or issues as well. The practice shows significant promise. It's being widely used by the DOD, and so we're looking to expand this to North Carolina and ask for your support.
Thank you. Representative Campbell, you're recognized.
Motion at the appropriate time.
Okay, is there discussion on the bill? It's good to see Representative Honeycutt here. Representative Clampett?
Motion to appropriate time myself, sir.
Okay,
I'll defer.
all right. Any other comments? If not, you're recognized, Representative Clampett, for a motion.
Has nothing to do with mopeds.
Absolutely.
Favor report for House Bill 572 with a referral to Rules, Calendar, and Operations of the House.
Thank you. You've heard the motion. Any comments? If not, all in favor, aye. Aye. All opposed likewise. The motion passes. Bill passes. You leaving, Representative Cunningham?
772.
Oh, 772. I was going to say that one for a long time, but Representative Cunningham, you're recognized to present House Bill 772.
Thank you, Mr. Chair. This is a real simple bill. It's the North Carolina Student Lifeline Act. It has already been implemented by 7 different states. It covers grades 6 through the 12th and complete of college. And simply what it does is takes and put the 988 number on the back of the ID, as well as the crisis line on the back of the student ID, as well as the North Carolina Warm Peer line. And the reason I chose Wisconsin's to follow it is because it can be put on by a sticker by the school. If the parent does not want the sticker on there, they can remove it. As simple as that. It also would go on every school website, home screen of any school-issued electronic devices, as well as the school agenda and calendar. I ask for your support for the bill.
Thank you. Representative Campbell, you're recognized. Any comments or questions? Hearing none. Do you have candy in there, Representative Belt? Any chocolate?
No chocolate.
No chocolate? Would the Sergeant at Arms remove Mrs. Belton? We like chocolate M&Ms. I'd like to thank the Sergeant at Arms, Terry McGraw, Nina Lage, Thomas Terry, and John Costick, because we were off, and then we were on, and then we were off, and then we were on again. But I appreciate y'all working hard to get it done. Okay, it's time for motion.
Mr. Chairman, I rule for a favorable motion on this bill, but I apologize, I do not know the next destination.
Referral to rules.
It sounds good to me, sir.
All in favor, aye? Opposed likewise? Bill passes. You're
Thank you,
ready to
Mr.
go to
Chair.
rules. I got to be here to the end, so we'll recognize House Bill 663, Representative Shepherd.
Thank you, Mr. Chairman and committee. This bill, we have passed it 3 times in the North Carolina House unanimously. It gets to the Senate, and I could probably say why I think it doesn't get anywhere, but I will refrain from saying that. But it basically is the Living Donor Protection Act. The only difference in this one than the ones that we've passed before is it also has bone marrow donations to this bill. It's an act to protect living donors from potential insurance discrimination, to provide an income tax credit for unreimbursed expenses, medical expenses, also to provide up to 30 days paid leave to state employees and other state-supported personnel who serve as living organ donors, and up to 7 days paid leave for bone marrow donors as well. And it's always been very supported, and I appreciate my sponsors with this also, Representative Wheatley, Representative Garland Pierce, and Dr. Campbell. If you got any questions, I'm free for those, but appreciate your vote and support.
Thank you very much. Any questions? If not, Representative.
I
Motion.
recommend a favorable report for the House Bill 663 with a referral to Finance.
Thank you. You've heard the motion. Any comments? If not, all in favor, aye. Aye. Any opposed? The bill passes. You again, Representative. House Bill 562, Representative Campbell.
Representative Honeycutt has the motion.
Thank you, Mr. Chairman. This bill is fairly simple. This is directing the Commission for Mental Health, Developmental Disabilities, and Substance Abuse Services to do rulemaking to change some staffing definitions for certain qualified professionals. This is to address workplace shortages in the mental health and substance abuse space. These are going to create associate degree tracks for these professionals. It does not change the on-the-job exposure requirements. It just simply shortens their didactic teaching time. This has the support of HHS, the community college system, and the Association for Social and Human Services Education. I'm happy to stand for any questions, Mr. Chairman.
Thank you. Any questions for Dr. Reeder? Good to see you, Representative Blackwell. He went to dinner. Representative Cunningham, our Honeycutt, our newest member to the committee. Welcome.
Thank you, Mr. Chairman. I'd like to make a motion at the proper time.
I believe that would be now, sir.
Make a motion for a favorable report to House Bill 562 with a serial referral to rules.
Thank you. You've heard the motion. All in favor, aye. Aye. And opposed likewise. The motion carries. The bill passes, and we'll send it on. Representative Dr. Reeder will present the next 2 bills for Representative Chesler, 547 and 928.
And there is an amendment on 547. We can do that first, if you would.
I believe there's
Is there PCS?
PCS, so
Yep.
without objection, the PCS is properly before the committee. Seeing no objection, it's there. Is there an amendment as well?
Yes, there's an amendment in front of you.
Okay.
And I'd like to, I'll do the amendment first.
All right, you're recognized.
Okay. The amendment for 547, the Children's Service Protection Act, is really just some technical changes, clarifying language, no substantive changes to the bill. Ask for your support.
Okay, all in favor of the amendment? Aye. Opposed likewise? You're free to direct, your bill is amended.
Okay, thank you very much. Members of the committee, nonprofit human service providers to deliver foster care, behavioral health care, they are facing a problem with getting liability insurance right now. Some of the things, the rising premiums are making it difficult for them to operate. What this bill does is says if one of the operators of an agency is operating under the auspices or at the direction of DHHS, that they don't assume the liability for the actions of the state agency. They're only responsible for their own actions. It does keep the victims' rights intact. There's just some fairness and predictability for the providers, and it makes it that they are able to get liability insurance. Happy to answer any questions. This has been vetted through the system, and there's agreement that this is needed.
Okay, any questions for the bill? Yes, sir. Representative Shabania, you're recognized.
Thank you, Chair. I'd like to make comment and ask a question to the bill sponsor.
You're recognized.
Thank you so much, sir. I want to commend your work along with Representative Chester and Jackson and Sheetselt with working with DHHS on making this a better bill and the commitment to keep working with them.
Absolutely.
Yes, and I do want to just ask one clarifying question that's been asked to us. So if families' actual damages exceed the cap, is there any recourse that they would have to ensure that their needs are fully addressed?
Mr. Chair, so
You're recognized.
the cap on, which cap?
When it comes to damages and fair assessment of legal remedies.
What line are you on?
Oh, I'm sorry, sir.
Yeah, help me out.
Maybe I'm reading too far into it. Maybe it's the other version. Actually, let me just reverse that. Thank you so much. I'll rewind my question. Thank you for the opportunity and for this bill.
Thank you. Thank you for rewinding.
All right, is there a motion favorable report to the PCS as amended, unfavorable to the original bill rolled into a new PS with referral to Judiciary 1? Representative Belk, is that your motion? Thank you. You've heard the motion. Representative Belk's been sitting over there eating candy the whole time. So. All in favor of the motion, aye?
Aye.
Any opposed? Did you say something, Representative?
Mr. Chairman, I apologize. I was a little late on my eye there.
Oh, okay.
I had a mask malfunction.
Well, it takes some further to travel that way. All right, while you're there, Dr. Reeder, you can do House Bill 928.
Okay, and I do want to take just a moment of personal privilege. Jamaica Pfister from the Children's Home Society spent all day with us to come to talk to us about this bill, and I apologize for not recognizing her, but thank you very much. We got the work done without but thank you very much. All right, House Bill 928 is a bill that allows physical therapists to assess and release students back to work after a concussion. This doesn't change the scope of physical therapists. They are already trained and able to do this. It just adds them to the list of people who currently can release students back after concussion to physicians, neuropsychologists, athletic trainers, nurse practitioners, physician's assistant. It doesn't expand the scope. This is already in their scope. This just adds to that list. There are currently 10 doctoral programs of physical therapy in North Carolina. All of them have training in the management of concussions in the neurologic curriculum. And I would ask your support. And before I forget, I want to thank Dr. Hannah. If she, thanks for sticking around the whole time. She, came to speak on the bill, but I suspect
I'll be glad to recognize her if she'd like to speak.
There you go.
If you would, state your name and who you represent.
Yes, sir. My name's Dr. Mary Kay Hanna. I am a physical therapist. I teach physical therapy at Elon University. I'm a retired Army officer. I was a PT in the Army. And I am the president of the American Physical Therapy Association, North Carolina. And the one example, I'll just back up, Dr. Reeder, one of my colleagues who lives out in Hickory has been seeing patients, children, student athletes at Elkins High School ever since his kids were there 20 years ago. He still does that. He's a volunteer. There are no ATs or physicians who work at the school, and because it's in our scope of practice, he evaluates and treats kids with concussions, but when he makes the determination they're ready to roll, then the family's got to find somebody else to pay, sign up, take the time and money and sign off. So it's in our scope of practice. We should be on the list of people who can sign off the schools. Thank you very much.
Thank you. I have a question. You're not related to Jack Hanna off of Wild Kingdom.
I wish I were, because then I would have an Australian accent.
All right. Thank you. Representative Honeycutt.
Motion at a proper time.
Any other questions? You have a question? Are you signed up to speak? Oh, we didn't have a sheet. I'll give you 2 minutes, ma'am. Please feel free.
Thank you so much. My name's Nina Walker. I'm the president of the North Carolina Athletic Trainers Association, and I just wanted to speak quickly on the proposed changes to Gefeller-Waller. This law was enacted in 2011 following the tragic death of two high school football players, Matthew Gefeller and Jaquan Waller. It is a result of carefully constructed language from the Medical Society, Brain Association of North Carolina, Neuropsych Society, Department of Public Education, and these groups met so that these terrible tragedies would never happen again. The basic reason why we are here just bringing attention to it is because we feel like this should be a physician-directed bill. And so by adding individuals that are not under the scope of a physician, that takes the physician out of the process. Anytime that we work with any athletes that have concussion, we as athletic trainers work under their direction, nurse practitioners work under their direction, the physician assistants work under a direction of the physician. And in the language, you'll notice that it says concussion trained. And I think that's the thing that we really want to make sure that any individual that is entering this bill has concussion training. And with that, I will move on.
Thank you. Thank you for your comments. Would you like to respond?
No, I appreciate those comments. I think that the physical therapists have the appropriate training. As we heard, it's just another group of people who can help our students get back into competition after the appropriate evaluation. So would ask your support for the bill.
Thank you, Representative Honeycutt.
Motion for a favorable report to House Bill 928 with a serial referral to rules.
Thank you. Any comments? If not, all in favor of the motion, aye. Opposed likewise. At this time, I'll invite my third cousin down on my mama's side, Representative Cervania, and we'll present a bill. Odd couple here. This is the genetic counselors bill, and Representative Cervania knows far more and vast amount of knowledge than I do. But with the genetic counseling becoming more and more in use, and the ramifications of decisions that you have to make not only affect your life immediately, but may affect your life in the long term, we need to make sure that those who are saying that they're a genetic counselor have the education and the degree, and that they're qualified to do it. Representative Sabani.
Yes, sir. Thank you, Chair. Thank you, chairs and committee. I also want to thank Chair Potts and Representatives Reeders and Campbell for being primary sponsors on this, and also providing the opportunity for me to speak on this bill. As Chair Potts has said, This bill protects patients, strengthens our healthcare workforce, and ensures that North Carolinians, especially mothers and families, receive specialized care that they need when it matters most. As our understanding of genetics advances, more families are turning to genetics counseling to make informed decisions. Whether it's understanding inherited cancer risks, planning for a child, and managing a rare condition. But there's a problem here. Currently in North Carolina, there's no licensure system for genetic counselors. This bill fixes that. It establishes a clear, nationally aligned licensure pathway and creates the Genetic Counselors Licensure Board to ensure only board-certified, qualified professionals can practice in our state. It brings us in line with 30 other states and gives families the confidence that there's care that there's care providers who have the credentials and training they deserve. This bill also helps our growing workforce crisis. It creates temporary licensures for recent graduates, recognizes out-of-state professionals through reciprocity, and supports supervised practices, especially important in our rural areas where the need is greatest. In many of these communities, families face long drives and long waits for specialized care. Genetic counselors bridge the gap and offer services that can lead to earlier interventions and lower long-term costs. And most importantly, the bill is backed by the North Carolina Medical Genetics Association and aligns again with national standards and is recommended by the National Society of Genetic Counselors. It also paves the way to expand telehealth, greater hiring flexibility for providers, and more trust between patients and professionals. So colleagues, this is a bipartisan, pro-patient, pro-provider solution. It supports our families, educators, clinicians across our state. Let's do the right thing for our mothers, our rural neighbors, and the future of precision medicine in North Carolina. I respectfully urge your support and a favorable report to House Bill 697.
Any members want to ask questions or speak on the bill? If not, yes. Representative Weekly?
Yeah, I just have a quick question, Representative, if I might. On this, the genetic testing for mothers, and is this more in a pregnancy setting, or is this for planning, or just at how would that be?
Yes, it could be at any stage.
Representative Savigny.
Oh yeah, sorry, Chair. Yeah, it could be at any stage, typically like for planning, yes. And also, typically during a pregnancy at that 20-week stage, it includes that as well. And further along if the provider deems it necessary or that the family chooses to have.
Thank you, Mr. Chair. We submit the bill for approval.
Yes. Representative Campbell, recognized for a motion.
Thank you, Mr. Chairman. I recommend a favorable report to this bill with serial referral to regulatory reform.
Okay, motion for favorable report with regulatory reform referral. All in favor say aye. All opposed say no. The ayes have it. The ayes do have it, and that bill will be moving along. Thank you very much. Representative Potts.
Yes, sir.
You are up for bill number House Bill 696, Healthcare Transparency Practitioner Act.
For those who were here last year, this was known as the badge bill, but our brethren across the River Jordan on the Senate side didn't want that, so they were going to run a bill this year without it, and they didn't. So a while back, we did it. The purpose of it.
Mr. Representative Potts, you want to do the amendment first? We do.
Yeah, we have an amendment. Yes.
Yes. Representative Ryan, you're recognized for an amendment.
Thank you. To send forth a minimal technical correction, basically adding family physician, family medicine on page 2 to the long list there.
Okay. We have a motion from Representative Ryan. Any discussion? Seeing none, all in favor say aye. All opposed, say no. Ayes seem to have it. The ayes do have it. The amendment is on. Representative Potts, you are on for the bill as amended.
Thank you, Mr. Chair. Basically, this says if you say that I'm an orthodontist, I'm a doctor, I'm a nurse practitioner, and you use it either orally on your letterhead or on your advertisement, whether it's online or a printed advertisement, that you have to have the qualifications that you say you have to back it up, so people who are using your services will know that they're not being treated by a janitor in a white coat or a builder in a white coat. That would be even worse. I ask for your approval.
All right.
Go on, but it's only 2 pages. So.
Yeah. Members of the committee, any questions or comments? Representative Honeycutt, I'll recognize you.
Thank you, Mr. Chairman, for a motion for a favorable report to House Bill 696 as amended, rolled into a PCS with a serial referral to reg reform.
And unfavorable to the original.
Unfavorable to the original.
Thanks very much. All in favor say aye. Opposed, say no. The ayes have it. The ayes do have it. And
thank you, Mr.
We'll
Chair.
move that along. And I will graciously turn the chair back over to you.
Representative Honeycutt has a lot of 2 years worth of experience, or 4, was it 4? Worked for Representative Sasser. And Sasser's name it was well chosen for him, his last name, as a young boy when they called him Sasser. So, and you can tell him I said that behind his back, but I'll be glad to stop by and tell him in person. But I appreciate everybody coming. Representative Belk has plenty of candy. Representative Scott has his MasterCard. We have it up here. We're all going out to eat. So
Where are we going?
enjoy the evening and thank you for coming. We're adjourned.